Good evening, everyone. Thank you for joining us for our workshop this evening. I am going to turn the workshop over to Mr. Pye.
Well, very good. Well, I have nothing really to say, so we'll call, no, I'm teasing. Thank y'all for being here today and indulging all of us in the district and all the parents out there and our teachers. We've come back from a nice holiday, but we come back to some drastically changing numbers that bring in drastic changing information from CDC and other places, and just so much conflict of those things, and the message is out there, and of course public is, they and our staff deserve an up-to-date, up-to-the-minute accounting of where we are at this particular time, and perhaps some ideas about where we might be going should things change or get better or whatever might happen. And so this is a discussion time. We'll present on the front end what we have, information. Some will be oldies, some will be new. And then I hope we'll have a nice, healthy discussion that will lend itself to many questions. So the questions you have are the questions that you're going to be asked after tonight, and questions that will be coming in. And maybe we can get a lot of that answered tonight and have a clear understanding everywhere about what's going on. Put everybody on the same page. Thank you so much. So Amanda, at this time, we'll turn it over to our district nurse, and she's graciously agreed to put the program together and to lead the discussion. I appreciate it so much. Thank you. We're not hearing you.
Is that better? Okay. So good evening, Mr. Pye, Chairwoman Hughes, and members of the board. We wanted to provide an opportunity to share some information with all of you about all the recent updates that have come out relative to COVID-19, as well as share a status update of where we are in the district. So this slide here is a report that you all are probably familiar with, the community may not be. This is sort of a snapshot of our community-based disease transmission based off of the Thursday report that comes out for school districts statewide. So as you can see, we've captured the information from October through the most recent report this past Thursday. And as you can see, unfortunately, while we were seeing that numbers were trending down for several weeks after that initial surge when we came back to school, we are seeing, unfortunately, that we are trending up again. And as of the 29th, we are back to an overall categorization of high. We are high in all three levels, and we are continuing to see an increase to all three metrics across the board each week. That is somewhat to be expected with the holiday break and increased testing, but overall we are seeing just an increased level of community-based transmission statewide. This next picture is, of course, our district dashboard, which is the document that we publish daily to provide an update of where we are in our schools, what our current quarantine and isolation numbers are. As you can see, we have 224 staff members out under both isolation and quarantine, and we have 2,426 students out between isolation and quarantine. This is current as of 6 o'clock last night, and obviously it does change every day throughout the day, pretty much by the minute at this point. So we anticipate that our report tomorrow will look similar to this, if not a little bit higher numbers. We wanted to just, again, sort of provide a definition for what isolation is and quarantine. We know this can be very confusing, especially when new information is released. And so we wanted to just update you on what those two things mean and how they're different from one another. So isolation is a term used to describe individuals who have tested positive for COVID-19 or are presumed to be positive based on their symptoms and their clinical presentation. Individuals isolate themselves and complete an isolation period until they meet the criteria to be released from isolation and resume normal work and school activities. Quarantine is defined as the period of time that an individual waits to see if they develop symptoms after an exposure. It's for anyone who has had a known COVID-19 exposure, and they quarantine from the last day that they were exposed through the end of their quarantine period to monitor for symptoms. We wanted to, again, just remind our community that all of our isolation and quarantine guidelines are set by the DHEC school exclusion list. So while the CDC may publish something and DHEC may publish something else for statewide guidance, we are required by law to follow the DHEC school and child care exclusion list because it specifically speaks to students and staff in schools and child cares in South Carolina. So any guidance that is posted that might be a little bit different than this is what trumps that. This is the document we have to follow for anyone who comes into our buildings, our schools, our students, our staff. So what has changed? What is different in the last week or so? We know there's a lot of information out there. There have been a lot of published updates. It's been all over the news, and so we wanted to just give you a snapshot of what's different from prior to break. There is new criteria for isolation. So again, isolation speaks to those who are presumed to have COVID-19 or who have been diagnosed with COVID-19. The previous isolation period was 10 days from illness onset. That has been reduced as of the 31st to 5 days. So individuals isolate for 5 days. They can return to school or work on day 6 if they meet criteria to return, including symptom improvement, and they must wear a mask for the remainder of their isolation. If the individual can't wear a mask, they have to complete the full 10-day isolation period. And so those are the major changes for that particular piece of things. The definition of what is considered vaccinated has changed, and this has been quite confusing. It's actually changed 3 times since the 31st. But the basics are that anyone who is 18 or over needs a booster after their initial vaccine series to be considered maximally vaccinated. They've added that additional definition, and you now have to be maximally vaccinated if you're 18 and older in order to be released from quarantine. If you are under the age of 18 but eligible for vaccination, you are fine as long as you've received your initial 2 doses, and you do not need to quarantine once 14 days have passed from dose 2. So that is the previous criteria of fully vaccinated for everyone, but it now only applies if you are 17 or younger. If you're over the age of 18, you have to have a booster to be considered maximally vaccinated. Another change is to the quarantine options. So this is our current Dorchester District 2 quarantine protocol based on the options that were available to us prior to this new change. We allow for a 7-day quarantine for staff with a test on or after day 5, and students quarantine for 10 days from their last exposure. Previously, 14 days was the standard. That was the recommendation from DHEC. They allowed us some options to reduce that for staff and students, and several months ago we implemented 2 of those reduced options. We went down to 10 days for students and 7 for staff with a test. They have now reduced the gold standard from 14 to 10, and this is currently what we are utilizing pre-new guidance. Unfortunately, the 7-day option is not available anymore. They have removed it from the equation altogether. It is no longer a viable option for students or staff in schools in South Carolina. It's off the table completely. So the current 3 options available are the 10-day quarantine, which is again the recommendation and the standard. DHEC recommends a universal 10-day option when there is substantial or high COVID-19 transmission in the community and increased transmission in the school. The second option is a 5-day option where you can test out on or after day 4 and then return on day 6 after completing 5 days of quarantine. The third option is a test-to-stay school-based option, which has come down from the federal government and is still being rolled out in South Carolina. Unfortunately, we don't have a school-based testing program. There are very few districts that do at this time because it is such a new program, but basically it involves 2 tests done between day 5 and 7, 24 hours apart in the school setting. So not community-based testing, but physically at school. So given the current options that we have, we really truly at this point have 2 options, and that's the 10-day quarantine or the 5-day quarantine with a test. So what we are proposing moving forward, since we have to adjust and 7 days is no longer available to us, we are proposing that our staff are changed to the 5-day quarantine option, which is similar to what they've been following now with the option to test out. They just are able to test a little sooner after their exposure and return on day 6 versus day 8. We think that this will help us overall in terms of our operational status of our schools and get some of our folks back to work sooner, but also continue to be cautious in monitoring for symptoms and ensuring that they're wearing a mask when they return. Obviously, with all quarantine options, those who are maximally or fully vaccinated are not required to do so if they are asymptomatic. So in this case for staff, anyone who is maximally vaccinated, 18 or older, and has received all doses they're eligible for would not need to quarantine. They would wear a mask and symptom monitor. For students, due to our current community and school-based transmission, we are planning to maintain a 10-day quarantine for students. As you saw a couple slides ago, there is that stipulation in the guidance that if you are experiencing a substantial or high level of community transmission, that a universal 10-day option is what they recommend. And we feel at this point, based on our school-based transmission as well as our community-based transmission and disease activity levels, that the safest option for our students is a 10-day option. And again, fully vaccinated students or maximally vaccinated 18-year-old students would also be cleared if they're asymptomatic and wear a mask. So we need to kind of talk about what our plan is. How are we going to continue to safely operate our schools and keep our students in school given all of these new changes? And one of those is having a plan for what we do if we need to switch a cohort, a class, a grade level to temporary virtual learning. It is not something that we like to do, but unfortunately, based on the criteria, it's something that unfortunately becomes necessary at times. So previously, we had an internal threshold of roughly 30% of students testing positive within a cohort, so a team, a classroom, would initiate us to place the remainder of those students on quarantine to mitigate further spread in that cohort. We saw it prior to break as the school year was first getting started back in August and September. We did have several classes that were closed essentially due to an increased number of cases, 3 or more cases in that classroom. There was no DHEC defined criteria for shutting down a classroom, only a grade level or a school. They have since added language to provide us with a recommendation for shutting down a classroom based on cases. So that recommendation is if there's 20% or more of positive or probable, meaning clinically presumed cases, within a classroom or cohort of 5 or more individuals. So they say classroom, they say team, pretty much any group that has 5 or more students who are traditionally grouped together, they would recommend at 20% of positive cases that you would close that group and provide them with virtual learning. The second level of criteria relates to schools and grade levels. For our purposes, it really is more of a school-based model. It can be difficult to look at it from a grade level standpoint because we hesitate to quarantine an entire grade level that hasn't interacted with one another. We really would want to avoid that unless we had to. But DHEC does provide criteria for what we would need to consider if we felt that we were reaching a point where we may need to shut an entire school down. So this is the criteria. It would be if you are unable to maintain operations with current staffing as determined by the school district, if you have 30% or higher rate of absenteeism due to COVID-19, so that's positive cases as well as students who've been exposed who are under quarantine, 5 to 10% or higher of the student body is isolated simultaneously, meaning they all have COVID, or when we discuss with a local healthcare agency and they recommend that we do so. So this would be, if Somerville Medical Center were to reach out to us and say that they are just at max capacity, the community transmission is too high, and they would recommend that we do this, we would discuss that with DHEC and move forward. We don't anticipate that happening, but it's an option that DHEC has provided. So if you recall, last year when we came back from winter break, we were in a temporary virtual learning model. We anticipated that our numbers were going to be very high when we came back, and in an attempt to mitigate further spread and cause transmission within our schools, we opted to provide an additional break after break to try to lower our numbers. This year, unfortunately, we did not have that ability, and so we are back in school and we are seeing the effects of increased testing and increased cases. So one option that we have to move forward is to implement this temporary virtual learning plan, obviously on a case-by-case basis for classes, grade levels, or schools. At this time, we don't qualify for shutting the entire district down. The Department of Education would like to see us explore all of those options first and potentially close classrooms or even schools if needed before we move to a whole district virtual model. And the second option to consider would be implementing a mask mandate. Obviously, there's always an option to consider this added mitigation strategy. There are certainly some enforcement concerns and some concerns across the board from our leadership and our principals, just because, you know, it's not an easy thing to require that 26,000 students wear a mask every day, wear it properly, wear it on the bus, wear it all the time. So it's definitely a concern. But we always do continue to encourage individuals to wear a mask, make them available to our students, and encourage our staff members to wear them as well. So what we plan to continue doing, in addition to implementing all of the required changes that have come out relative to isolation and quarantine, would be to continue reviewing our weekly DHEC community level data. That's that first slide that shows the trends of the metrics, as well as our district-specific data to determine the effectiveness of these strategies. We want to make sure that we're keeping an eye on what's working, what's not working, so that we can monitor and adjust as needed. So that's all I have for you, but Mr. Pai has invited the district leadership as well as his principals here, so we can all answer any questions that you may have.
Okay, does anybody have any questions for Ms. Santa Maria or Mr. Pai or?
I have a question. And I don't know, Amanda, you might be the one to answer it, but you had on one, I'm not sure what page it was, we're sharing this PowerPoint, but the DHEC has now said to go virtual at 20%. Where did, I mean, there, at 20% of a class or a grade, where last year it was at a 30% threshold. So I guess my question, is this a guideline or is this one of their mandates?
So it's a guideline, it's not a mandate. They provide recommendations to help guide school districts in those types of decisions. Previously, they did not have a recommendation for when to close a class, so internally we had discussed and we had come up with that roughly 30% metric. Again, we've seen that we've had to utilize it just, I think today, where I think we're up to 16 classes that have had to be closed due to reaching that 30% mark.
The 30% mark, not the 20, the 30, okay.
The 30%.
And then the temp, it's just a temporary virtual learning. Was that a guideline or was that a mandate?
No, so the temporary virtual learning options associated with those thresholds are all just options for when a district can consider closing a class or a school. I will say when it comes down to the classroom, they feel pretty strongly that when you reach that threshold within a class and you're seeing that many cases, that you not allow students to continue face-to-face because they're seeing such high level of spread within that group. If you have 3 or 4 cases in a class of 17 or 20 students, you're seeing pretty high transmission amongst those students, especially some of our smaller classes, our elementary classes, and obviously our special ed classes.
And the other question I have, if a parent decides, you know, they are going to continue their child because even though they test negative now, but they are not feeling well or whatever the reason, are we going to give them an excused absence?
If they're keeping their child home because they're not feeling well, or because they've tested negative?
They've tested negative, but they're not feeling well, they still have an excused absence.
I think typically our principals work with parents, and if the parent is trying to do the right thing and keeping their child home because they're not well, they typically, you know, either accept a parent note or a doctor's note. Even if they've tested negative, they always want sick children to stay home.
Okay, thank you.
You're welcome.
Okay, anyone else? Ms. Wimberly?
I actually had a question about the choices, the options, when it comes to the quarantine. So the 5 versus the 10-day. I was reading when the CDC put out their most recent guidance, it looked like they said the reason for allowing the possibility to shorten to the 5-day is because they're seeing the majority of the transmission occurring 1 to 2 days before symptom onset and then 2 to 3 days after. So that kind of explained the reason for the option for the 5. So I guess I'm just wondering if that's something that we should be considering. Just because I think having children out of school for the 10-day quarantine when they're well is extremely disruptive for them, for their teachers, and for the parents, so just in general for everyone. So, and also, I know I've been hearing a lot of feedback from parents with a system that sets up a 5-day isolation for a positive test versus a 10-day quarantine for a well child. You've got people who are wishing that their child would test positive, which I can kind of understand and seems a little crazy. So I was just wondering if we could discuss that a little more.
Sure. So previously, when the isolation period was still 10 days for individuals who were positive or presumed to be positive, and the quarantine was 14 days, we got similar concerns from parents. How can my child who's been exposed stay out longer than my child who's sick? And again, as you mentioned, the illness onset period does begin 2 days before your symptoms or your test and extends typically about 3 to 5 days from there. So they've been able to really hone in on that data and determine when an individual is most infectious to others, and that's why they were able to reduce the isolation. The options for reduced quarantine, again, at the time from 14 to 10 or 7 with a test, came initially last January, and because our community transmission was as high as it was at the time, we as a district opted at that time to continue with a 14-day quarantine, even though it again kept students out 4 days longer than students who were positive, because at the time we didn't feel it was the safest option. We're in a similar situation here. Even though they've just now reduced the isolation to 5 days, we are still seeing that the safest option for quarantine is 10.
Okay, yes, and that makes complete sense, especially when you look at last year's situation. But I do think the situation may be a little different now. I know we hadn't really talked about the severity that we're seeing in the cases with children. So do you think that kind of changes things slightly?
I think it's certainly promising that it seems to be less severe, but unfortunately it's much more contagious. And so when we talk about the exposure to others and keeping them in school or potentially keeping them out to see if they develop symptoms so that they don't further spread it, while it is potentially less severe for them, it is much more contagious. And so that's really the purpose of quarantine, is to prevent that contagious piece from spreading further. So it definitely is a tricky situation, but at this point they are still recommending, when you are seeing substantial spread, that you stick with the 10-day option.
I'm just concerned because it's so disruptive to continue to have children out of school for, 10 days is a long time. And it's disruptive not only for them, but for their teachers too, because it puts a lot of added burden on our teachers, I feel like, as well.
Well, and Ms. Marulli, that was something, and I'd asked this last year, and I never really got an answer because they said it's hard to differentiate, but in the past, like in 2016 and 2013, January is typically a month where kids get sick, and so do adults. I wondered what the numbers were, not the quarantine, because we didn't quarantine if they had the flu, or, that was going around like crazy. We didn't quarantine, so I would love to see what the numbers were 5 years ago or 8 years ago in January versus what the numbers are just with COVID, not with other sicknesses, the testing positive. Is there a way that can happen, that we could see that?
The numbers for student absences?
Right, sick, not, would you be able, and maybe that was the problem, they couldn't tell if it was they were on a field trip or they were out of town or at a funeral versus they were sick with the flu. But January is such a sick month anyway. I was just wondering, if you didn't count the quarantine, just the sick children in 2015 or 14, if the numbers were kind of the same versus the positive testing that we're getting. It just would help us to see the severity of what's going on now versus what went on then when we did not quarantine, because we're just not sure.
I would like to add to that too, is what are the number of actual flu cases that we are having? Because everybody now just says COVID, but so many different articles you read that flu is more contagious and more widespread for children than the COVID. So do you have any kind of numbers for just flu?
Sure. So we report all of our flu outbreaks to DHEC. That's a mandated reporting piece that we have to do. And currently, school year to date, we only have one school that has been required to report their flu cases due to 4 cases in one classroom. We have not seen any other flu outbreaks district-wide this year, which is pretty unusual. Last year we had none, and the year before that we probably had between November and February probably about 6 schools that had reported at least one classroom cohort that had a flu outbreak. So we had none last year, we have 1 so far this year.
Go ahead.
Mr. Pye, do you know of any other districts in South Carolina that are doing the 5-day?
As of yesterday, I guess it was, no, that was Sunday, Friday, we had heard of none, but a lot of board meetings are taking place this week, and basically people who told me no this morning might have a yes tomorrow. I know it's one of those things that's under consideration, and it really is back and forth. We have spent a good bit of time deciding that, and keep in mind, this was just a recommendation. It can be changed by the board instantly. It was so close of a decision. It's not one in which we're going to sit here and say, oh, you've ruined the whole school system with this stupid thing. No, it is a real problem for us, and they did lower it, whether they should have gone that far or not. The thing is going to be just keeping up with this also, with the kids coming back, and what happens, they come back too soon and they're not ready. We then have to send them back, and that's going to be a new situation involving parents and children that, how dare you pick on my kid because we think they're fine. They go to school and the nurse says they still have an issue. Well, that's what the nurses always said. If they make it to the nurse's station, she rules. But this is one of the real big questions we had, that we put down the areas that we had a choice over. But I want to reemphasize any of that, where there's 2 options, and we've given you an idea that one is sort of where we're leaning, doesn't mean it has to be one. It can easily be 2. We'll do what we have to, because we were divided too. We've had a real time, and we've gone over it a lot longer than you have, and it's still a real questionable area. It's gray.
So just to clarify, if you were to choose the 5-day with the test, they have to have the negative test on day 4. And then what if they can't find a test, or if the parent doesn't want a test?
That's part of the issue.
Then they stay home for the full 10? Is that what happens?
Yes. That test has to be done on or after day 4, and if they test negative, then they can return 6.
That is their CDC's rules, it's not ours. So we would have to, so if we go to that, that's one of the trade-offs.
Mr. Pye,
Yes.
don't we have a trailer that we're doing testing now out there
Yes,
that the
ma'am.
kids can go and be tested?
I was at it Friday, and I was at it this morning.
We do
I've been
have
there twice in the last 3 days, checking on myself.
No, what I meant was because of the fact that, could they be tested, you said? Well, there is availability, so there's no reason they shouldn't be able to go get tested.
I think, is there a shortage right now on the rapid
So,
testing?
Yes, there's a statewide shortage on rapid test kits. We are fortunate that we only went 1 day last week where we didn't have those available, but they are on back order. PCR tests are also taking what used to be 24 to 48 hours to come back from the lab. They're seeing about a 6 to 7 day turnaround time, which is causing a delay in reporting and increased testing,
So it's
because
really
people are getting tested for PCR last week, not getting the results, and then coming back a second time and looking for a rapid test. So we're seeing a huge number of individuals being tested at our test site, and that is only for students and staff. We've done about 3,000 tests in the last 2 weeks.
We currently have rapid tests there?
We do.
We have them.
We do.
Thank you.
And that's for any students, staff, teachers?
Any students or staff members in the district, yes, can utilize that.
Say that again.
Any students or staff members in the district can utilize that.
Any other questions or comments? Mr. Farnsworth?
Thank you, Ms. Santa Maria. I'm actually looking at the exclusion list here on my laptop, and it's about as clear as mud to go through all these blocks and understand what they're trying to do with COVID. So I just want to make sure I understand. So the exclusion list allows for the 5 days. The 10 days that you were talking about earlier, that's specific, that's guidance from DHEC as well as the CDC?
Yes, so the CDC provided options for reduced quarantine and isolation just before New Year's Eve last week. DHEC adopted those options, and then over the course of this week, they've clarified that guidance specific for schools and childcare facilities. So the exclusion list speaks to the specific mandatory criteria and options available. The school and child care booklet for K through 12 schools goes into further detail about how we implement the exclusion list.
Okay, I guess what I'm trying to get at, and yeah, see, this came out on January 8th, so just a couple days ago, the exclusion list, the new one. I guess the question is, are we looking at the 10 days? Is that going above and beyond what's actually required by the exclusion list?
So the exclusion list just requires that we quarantine anyone with a known exposure and provides 3 options for that quarantine. 10 days being one of them with the recommendation when you're in high level of spread, 5 days with a test on or after day 4, and then that school-based 2-test, test to stay
Which we don't
option
have.
that is not really an option for us at this point.
Got it. Okay, thank you. Maybe afterwards, we can just look at these blocks, because I'm not being able to reconcile those 3 options. And again, I think I'm just missing something in the exclusion
The
list.
first few pages has the COVID-19 isolation criteria, and then you have to scroll down like 10 more pages to get to the exclusion criteria for exposures. It's in 2 totally separate parts of the document, makes it a little confusing.
Yeah, absolutely. Okay, thank you.
Okay, any other comments or questions?
We've got plenty of time for discussion, and this is a topic, trust me, that's being discussed and cussed all over the place. So please throw things out, because I want people listening to hear that at least we know some of the concerns that we're hearing about, and at the same time, we're trying to weigh everything, and where we have no wiggle room, such as option 3, is not going to work for us, but either 1 or 2 can. We told you what the guidance was. We made that very clear because you'd want to know that. We told you what we felt our staff was leaning to. But at the same time, there were parts of our staff, people that felt it should be the 5 days, and some of you have indicated that in the past. So they're both really on the table. We had to have a starting place, because my goal was shoot holes into it. We want you to, this is not a etched in, you support us or you don't support us. We're not going into that. This is strictly about what's the best plan for Dorchester 2 and our community at this time. That is what this is about, and it's still limited any way you look at it. There's not a silver bullet in this, but surely there may be a better compromising point that we could still say we were safe, and we could do it. If that was your wish to do, we'll make it happen.
Ms. Crosby, did you have something that you wanted to say? Nope.
I just say, we're already getting emails, and I know y'all are too. And my heart, my condolences or my thank yous, whatever, goes out to every principal in here, and especially to you, Amanda. But they're so worried about the mental health issue and how their children are getting upset and already getting anxiety, thinking that we're going to go virtual. And I don't think we have any plans to do that whatsoever, unless some horrible thing happens. And I guess that's why I asked if we did do something like the 5-day. That's why I was asking if a parent still felt, okay, they're negative, but they're still not feeling okay. It's perfectly fine if they wanted to continue carrying out the other 4 or 5 days, and they would still be an excused absence. And that's my concern, are the emails that are coming in about the anxiety, their children, and the depression, which is a big thing. So that's why I am appreciative that you're letting us mull over different ideas.
You want to bring up yours?
We
have
probably
another-
received this,
Go ahead.
excuse me.
I'm sorry.
We probably received the same email from some of the same parents that were saying that, you know, that they were concerned about the mental health and the depression, and the suicide rate has even gone up, if y'all have noticed, with this COVID mess. So there's no right and wrong, again, like we said before, but I hope we could take all those things in consideration before we would ever think about going virtual.
Well, I'm not a fan of virtual. I've said it numerous times. It doesn't mean we would go to it. I did take it upon myself to call the highest ranking official under Molly Spearman in Columbia to get clarification of the rule. I explained it as best I could, what we were doing, and I had witnesses to that. And I thought I did a very good job, and the answer was no. you will send children home individually first. If it's enough children, then you close the classroom down. Then you look at maybe it's a grade level that's a problem. You take, maybe it's just first grade, we'll let first grade, they stay home and they do virtual. And then it's the whole school, one school at a time. It could be one school, it could be all 25, but it has to be every school. It can't even be one left. That one gets to stay open. They're not gonna make anybody do virtual if they're not qualifying with a severe number. And of course, we could sit all day and debate how strict the numbers are, not strict enough. And we've had some emails to that point about, how much are we gonna drop this thing down to that after a while, it's just nothing, period. And I see that side too. So it's still out there, a lot of confusion, and it seems to be no authority that's able to say how really effective one thing is over the other. We all know the longer you take, it's bound to work in our favor, but is it just a matter of, all right, I'm gonna, wait and see if my tooth hurts tomorrow, and if it's hurting by Friday and this Monday, then I'm going to the dentist. I think I can tell on Monday if I need to go to the dentist or not. I'm not gonna wait till Friday. So it's almost that simple, but again, parents have work schedules, have other issues that conflict, and they're trying to work around what's convenient and also what their philosophy might be on the safety of their children. It doesn't mean they're wrong, it's just everybody's not on the same page, and it's very understandable because I can tell you how confused I was Sunday about this. And so a workshop was ever needed. It certainly was needed today to begin to put forth some of these things. And I think Mr. Mitchum has something along these same lines he wanted to ask the question.
Hey, Nurse Santa Maria, I was just looking at slide 14, DHEC defined threshold of 20% or more positive within a classroom, and we're doing the 30%. Is this something that we as a board can stick with the 30%, or do we have to go to the mandatory 20% or more?
No, it's just a recommendation, so it's
Okay.
something that they've provided us with as an option. We can certainly stick to the 30%, and that's what we've been utilizing
Okay.
past week.
Okay, thank you.
That's what we're trying to decide tonight. If you feel strong about that, please state your case, because it is still optional. As limited as they all are, it's still an option.
And I should add, I forgot to mention this sooner, our desire to stick with the 10 days is not something that we would like to do forever. We just feel like our community-based and school-based transmission right now is so high that it would not be the smartest time to attempt to reduce it, but we certainly will continue to monitor the data, and if you all are in agreement that we continue that, we would attempt to shorten the quarantine as soon as we felt it was safe to do that.
Mr. Pye, can we, I would like to hear some of the discussion that went on when you were sitting here and you were talking about these, trying to make these decisions because I'm looking in the presentation, we've talked about quarantine, the times being lengthened or whatever. We've also talked about the possibility of mask mandates as being an option and that kind of thing. So I would like to just hear some of the discussion that went on whenever you were trying to come up with this plan that you were presenting to us.
And other than Ms. Santa Maria, would you like to, maybe Laurie, I see you position yourself. Why don't you come up and give some thoughts about some of the questions you personally had?
Well, we wanted to hear from the principals because they're the ones that are experiencing staffing shortages and numerous student absences in the school. So Ms. Radcliffe and I asked them for some feedback this morning before we went into the meeting to discuss with Mr. Pye. They were concerned, as you all heard back in October when we talked about a mask mandate, some of the exact same issues came up because, quite frankly, they would have the exact same issues now in January that they would have in October. So they weren't sure that that was something to move forward with, or that it would even help at this point because, again, our children are eating lunches together, obviously without a mask so that they can eat. So we did not know if that was an option. They are very concerned about, and this is, I'm speaking for elementary, and of course Ms. Radcliffe can come up and talk about secondary, but some of the same things. They are concerned about the staffing shortages. They, as a group, have had to piecemeal since we've come back, from Christmas, they've had to pull every single person possible to cover classes. Facilitators, math coaches, teaching assistants. I've had principals call over and say, do you have any district interventionists that you can send over to help cover art class today to help? And we've had to do that. My administrators are going into classes and covering. They come in the mornings at 5 o'clock at the elementary level. They look to see who's going to be out. And it's not just the numbers that are on the dashboard, because that's just COVID related. There's also people that have to be out for other things, doctor's appointments, surgeries, whatever that may be. And then again, they're allowed to come back from their quarantine at day whatever, but as Ms. Robinson said, they may still not feel like it, and they still may honestly be sick and not be able to come back. So we've got those absences as well. I don't know that I have answers, but that was a lot of the discussion, because as we sat there, I kept getting texts and emails. I've got 3 more going out. I've got 2 more going out. And today was a work day. They didn't even have students in the building. Tomorrow, students come back. And so again, it's just the safety of covering those classes and making sure that they have enough. That, I think, was our biggest concern and our biggest discussion today, was trying to come up with how long can we sustain going without 17, 18, 19 staff members being absent in a building.
Point that you also brought up this morning was that if they had their druthers, they felt a short virtual program. We did the 7 days, might be a great way, or a long weekend that would allow that healing time to get everybody back down to 0 like we did last time, and hopefully the numbers would be on the downward trend, and we could get out, get out and fight comparatively with it instead of keep falling behind. But they didn't know what I just shared with you. That is not an option. We cannot and will not be closing Dorchester District 2 schools. It has to be approved by the State Department, and the answer is a no.
Right.
They don't even want to consider it. I have to show proof to them and CDC that we've tried everything we possibly can to lower those numbers. And so there are, the options, the other thing we could do that might be in favor of that, they would want us to have tried it, the mask back, all kinds of things is what they're saying. And then we closed by individuals are sent home, then classrooms, grade levels, schools, and then the district. So the chance of closing the entire district is pretty slim to none. And I don't know of any district that's gone completely virtual from I could tell. We've heard rumors, but we've not been able to substantiate any of those. They might be getting ready to recommend to their board such a thing, but they're going to have to be in compliance. And I've been looking at the numbers too, and I don't see a school district that I feel is close enough to do that.
Yeah, I think there's a lot of districts that are doing basically what we said. If they're monitoring them by school or by cohort, and they're putting that school out. So you got whole schools that may be closing, but not a whole school district. I mean, there's several around the state that are doing that. So
it's the premise that the State Department is following the lead of the Legislative Assembly. They want the children in the classroom learning with their teacher. That is the #1 learning style, and that's what the legislature folks, no matter what we say or do, that they're married to that concept, and so is the State Department of Education. They are having to carry out all these provisos and these things, and we know that they have differed with the governor on the mask and all those things. We could write a book on all the ways they differ, but those are some of the things that they've stuck true to, that they're really disfavoring that because of the very bad publicity I think it received. No matter how it was done, right, wrong, or indifferent, there were pockets of play in every district that was not done like people felt it should have been done. So that's the issue that has kind of guided people away, but we as a district have no control over that. So I want to make sure my principals, if nobody else hears it, you leave out here today, that is no longer an option. That's why we might have to look at something else. If you feel that strong and we've tried everything that's not working, then we're asking you to tell us what we could possibly do that could maybe reduce these huge numbers.
Mr. Pye, I understand the reasoning behind the staff being reduced to 5 days, because you're obviously wanting to get them back in the classroom as quickly as you possibly can. But what is the why is it that your staff and your students would be on a different, I mean, and I'm sure you have a reason for it, but I just want to hear what that reason is. Why is it that they are on a different quarantine rate?
I heard it very loud and clear. Go ahead, Amanda, and say how that was looked at.
So they're currently on a different requirement. Our students are currently 10 days and our staff is 7 with a test on or after day 5. We had to make a decision when DHEC removed the 7-day option, whether we were going to increase staff back to 10 days or allow them to reduce. We feel like staff members are able to accurately report their symptoms, consistently and correctly wear a mask when they return early from quarantine, as well as monitor their testing and making sure that they're getting tested on the right dates with the right type of test. So overall, we felt like it was a compromise to reduce them down to the 5 to assist with our operational status. But from an overall district safety standpoint, the universal 10-day would still be the safest option. But for staff members, we felt we needed to adjust and we didn't want to go back up to 10, so we reduced to 5.
Okay, quick question on that then. How are we going to differentiate between someone saying they have COVID or someone saying they've just come in contact with COVID?
We intake all of our COVID situations. They typically go through an administrator if they're a staff member, or the school nurse sometimes if they're a staff, but always if they're a student. That information comes to us. We follow up with the parent or guardian or the staff member, get more information from them on whether they've had an exposure, when that exposure occurred, whether they're symptomatic, when their symptoms started, if they've been tested. We get all of that information, plug that into the criteria that we have to use for isolation and quarantine, and then provide them with their proper exclusion as well as their return date. So in the similar way that we've been doing.
What if a parent just says, over the weekend my child was exposed, or my child got COVID over the weekend because maybe they were exposed and they don't want to wait the 10 days. You know what I'm saying? So how do we, because they don't have to have a test, all they have to have is be symptomatic, correct?
So if an individual has symptoms of COVID, they're excluded from school under COVID-19 exclusion criteria, which is even for those who have not been tested. They isolate as if they are positive. They stay home for 5 days. They can return when their symptoms improve or sooner with a negative test or a doctor's note. If they're diagnosed with COVID, they do provide us with documentation of that, and they're treated as a positive case. And then individuals who are exposed, unfortunately, there is no way to get proof that they've had an exposure. So for non-school-based exposures or household exposures, we have to take their word for it that they've had an exposure and quarantine them.
So in other words, if they tell you they have COVID, they have to show a test that shows that they have had COVID.
We ask for proof of that diagnosis.
So
yes.
it's not just if they are symptomatic of COVID.
If they're symptomatic, they are still required to be excluded, but they don't have to provide us documentation that they're having symptoms. They just report those symptoms to us and they fall under COVID exclusion criteria. We don't treat them as a positive case or quarantine their close contacts because
Right.
they are just symptomatic and either pending test results or choosing to isolate. It's only for positive cases with a confirmed diagnosis or presumed positive cases who, per DHEC's criteria, are presumed because they've had a known exposure plus their symptoms.
Okay, so do you also get the testing results from DHEC? Because I know a lot of that stuff goes through DHEC. So do you also get those results from DHEC as a part of your data gathering to contact parents and that kind of thing as well?
Yes, we get emails every day from DHEC with cases as well as exposures for individuals who have a household or outside of school exposure. Not all of them are captured there, but a good majority of them are. We also get the results directly from our on-site testing provider. So everyone that is tested there that tests positive, that report comes to us.
Okay, thank you. Ms. Wimberly?
So what type of instruction are we currently providing for students out on quarantine and isolation too, I guess, if they're well enough to participate?
All right. Elementary and high school may be a little bit different.
We're doing the same thing that we've done in the past. If they're out on quarantine or isolation and can't participate, then we'll either do dual modality, or at the elementary level, they also have the option of when they return, they can do after school or Saturday school to make up that instruction. And the dual modality is where the teacher continues teaching, turns on, I didn't want to make sure everybody understood what that was.
Is this, you got something different, Karen? If you do, add it.
Do we have any feedback from our teachers about that? Because I know that's an added stress that
All over the state of South Carolina and the United States, but
we're still paying them, correct?
yes, we are. It's just a necessary evil. It's either that or they stay home untaught, so that's not a good choice.
It is. At the secondary level, we are doing much the same as elementary. It's still the dual modality. At the secondary level, we are offering our academic overtimes on Saturdays to help our students that are currently in quarantine. Also, we offer at the high school level evening school, which allows those students who have been quarantined to get some additional assistance in their classes, tutoring, and any kind of retesting type opportunities. So we are putting in some safety nets for our students that are out on quarantine.
I know I've seen firsthand with my students, with the block schedule, 10 days is a lot of school to miss.
Lot.
It is.
I mean, those classes are moving quickly.
Yes, they are. Very. So that's why the academic overtimes, the evening school options are very important for those students. They need to take full advantage of those.
We even have unit recovery. They don't have to wait till they start failing up only behind the course. They can do it within the unit they're working in. If that's the time they missed a lot and they're showing signs that they are missing a piece of work before they can really go to something else, they need to catch that up. So we're doing that too.
Okay, any other questions or comments, concerns? Nope. Okay, Mr. Pye, do you have anything else for us?
Well, if
regarding this?
any of you, and many of you have friends and relatives in other school districts, and you've shared with me from time to time various things that you've heard about or read about, and I'm asking you to do that. I know earlier this afternoon, Mrs. Crosby sent me a note that she had picked up somewhere on the wire service that Georgetown had decided to go virtual as a school district. We've been trying to verify that, but we have not. And they're good about telling us stuff ahead of time, and we've not received that. So I'm doubting that that's a correct assumption, but it could happen. Things are happening very quickly. I don't know what their numbers are. I thought last time I looked, they were similar to ours. Of course, they're a smaller district, so it wouldn't be the same number, but percentage-wise, they were about along with us. So we're monitoring that, and we're trying to check with every district to see if anybody is coming with something different. And any of these options, whichever we go, we're monitoring them to see if they're working or could be more effective. And we're getting information from our community partners, those folks, about what else is out there, how well is that working, why is it working for you? And they may have added something to this that we hadn't thought of adding. That's fine, that's legal, that we might want to put that in place so we could have a shorter time or whatever it is we're concerned about. I think it's nothing better than this is new to everybody. No one has a silver bullet. We're dealing with several monsters out here, and the virus, I don't think it's the monster. A lot of misinformation, a lot of experts, and they're not on the same page, a lot of finger pointing, but we're the one, it's our children that's at stake, and we don't want to be trendy. We want to do the right thing.
Okay, I guess then if we have no other questions or comments, and Mr. Pye, you've given us all the information you need to give us, then
That's
we're
pretty
done.
well it. And again, when, every day, every hour, every minute, I want to hear from you. A couple of you did contact me, and I cannot tell you how much I appreciate that, because we are really torn, and I just want somebody to tell me, you got to be kidding. And you might hear me come back and say, no, I'm not, but I think just like you do. Let's talk about this. And there's always a different way to look at things, and we're a team here. And so I want us to be on the team, not necessarily to agree, but I want us to have the same point of interest and purpose and feel that we, all in our hearts, we don't like it, but are we doing the best that we can do overall for the whole picture? And so that's where we are.
Okay. All right, well then we will adjourn the workshop setting, and we will be back at 6 o'clock for our board meeting. Thank you all very much for coming.
Thank you, principals. I appreciate you being here, and you all were so